Ebola has an incubation period of up to 3 weeks. So say you're in an elevator or on an airplane with someone who is Ebola. The particles that they cough or breathe or sneeze out is now airborne, and you could very well catch Ebola. I think it's beyond containment. If not for the hand of God, I don't see how they're going to stop it from spreading around the world.
So far, hundreds of cases have been reported, with more than half confirmed as fatalities. And the disease is moving rapidly across borders, with new cases already reported in neighboring Liberia and Sierra Leone. WHO estimates that 9 out of 10 people infected with the virus will die. People who are in contact with infected persons are encouraged to seek immediate help.
What is really important is to inform population of Guinea and Conakry about this disease.
While there is no known cure or vaccine for Ebola, UNICEF continues to provide much-needed medical supplies. But transmission could be stopped if people take precautions such as limiting travel to areas where outbreaks have been reported and avoiding contact with those who exhibit symptoms of infection. Ebola first appeared in 1976 in 2 simultaneous outbreaks, Sudan and the Democratic Republic of the Congo. In the Congo, it happened in a village near the Ebola River, from which the disease took its name. A lethal virus is usually transmitted to humans through close contact with blood or secretions of infected animals. In Africa, the spread of the virus comes from handling infected apes and monkeys. It is then spread to humans from direct contact with an infected person's blood or secretions. The tropical virus leads to hemorrhagic fever, causing vomiting, diarrhea, and in some cases, organ failure and uncontrollable bleeding.
I'd never read much as a child. The moment I opened it, I was just engrossed by how this disease came from monkeys and very gruesome parts about how your organs essentially disintegrate inside of you and you die from vomiting your dissolved organs.
Since January, nearly 600 cases of Ebola have been confirmed in Guinea, Sierra Leone and Liberia. The meeting held in Ghana shows that the region's health ministries recognise the scale of the outbreak. Working in all 3 affected countries, MSF hopes that this awareness will convert into concrete action because the outbreak is far from under control. The teams in Gekedu in Guinea have treated 130 patients and 31 have recovered.
Kiza, who is a nurse, has come to offer his services. He and his 3 children contracted the virus in 2007, and they all survived.
The message I can tell the people is that personal protection is the most important thing, by hand washing with soap or chlorinated water before you touch yourself, more especially around the mouth, around the nose, around the eyes, because this Ebola is not an airborne disease, but it is a direct contact.
Stringent protection measures and airtight clothing. Ebola hemorrhagic fever is a highly contagious virus. The medical teams adapt to the situation in order to provide the best possible care. The virus, which is fatal in around 60% of cases, is transmitted through contact with bodily fluids such as blood, stools and vomit. There is still no specific treatment for the virus.
Okay, and we'll show you and we'll have people there to help.
In order to prevent the epidemic from spreading further, MSF is working with the Ministry of Health to identify, isolate and treat infected patients quickly. The organisation has also been working in the Democratic Republic of Congo, where an Ebola epidemic flared up in August. This is a different strain of the virus and has already killed 14 people.
Communication is key to combating Ebola, as fear and stigmatisation must not prevent the sick from going to health centres. Each time a recovered patient returns home is an opportunity to raise awareness among the community. The sooner a patient receives treatment, the greater the chances of survival.
This is the VOA Special English Health Report. Uganda's latest outbreak of Ebola virus is the fourth in recent years. About 200 people died in the biggest outbreak in 2000. 37 people died in the last outbreak in 2007. Ebola is a hemorrhagic fever. It can lead to bleeding inside and outside the body. Symptoms of the disease include high fever, vomiting, and sometimes diarrhea. Other signs include weakness, muscle pain, headache, and sore throat. Ebola spreads through contact with blood or other body fluids of infected people. The virus is often deadly. There is no cure and no vaccine to prevent the disease. In July, President Yoweri Museveni urged Ugandans to report all suspected cases of Ebola. He also urged people to limit their physical contact, even shaking hands. Yoweri Museveni said, "We discourage the shaking of hands because that can cause contact through sweat, which can cause problems. And when people are sick in hospitals with symptoms which look like Ebola, they should be handled by medical workers wearing protective gear." President Museveni also warned people to let medical workers bury suspected Ebola victims. He said, "Please do not take on the job of burying him or her. Call the medical workers to be the ones to do it, because they are the ones who can do it safely." Most of the cases in the latest outbreak have been reported in western Uganda. A World Health Organization official said the first cases in July were mistaken for cholera. But Dennis Luomafa from Uganda's Ministry of Health says Uganda has improved its ability to identify cases of Ebola. He said Uganda is probably in the lead when it comes to dealing with hemorrhagic fevers in Africa. He said the diagnosis of the Ebola virus outbreak was done in Uganda. Dennis Luomafa said although the disease is also found in nearby countries, outbreaks are not always identified. He said, in other countries, especially in some of the neighboring countries, many times Ebola goes unrecognized, and other times it goes unreported. He said in some neighboring countries, Ebola destroys whole villages. He said it then disappears because there is nobody left to infect. Ebola fever is named after a river near the first recognized outbreak. That was in 1976 in Zaire, now the Democratic Republic of Congo.